Hello guys. So the topic which we are going to learn today is rubber dam. And within rubber dam, there are four important points which we are going to understand. The first is introduction, followed by components, application procedure, and removal procedure. So let's start with the introduction. The first point which you can write is the history of rubber dam. It was first introduced in 1864 by Dr. Stanford C. Barnum. The purpose of rubber dam is basically to ensure dryness. It also improves the quality of clinical restorative dentistry. It basically enhances the efficiency of the operator. So moving on ahead, within the usages, like we already discussed, it is going to separate the operating field by isolating one or more teeth. It also blocks saliva along with blood and other components or other contaminants, and it also retracts the soft tissue. Now, we also can rate advantages and disadvantages within the introduction. So let's start with the advantages first. The best and major advantage is moisture control. So this includes blood, saliva, like we already discussed. It is going to give us a dry, a clean operating field, enhances the physical properties. And when we talk about physical properties, this goes especially for composites or any materials which require um, no saliva or any of such other factors. Next, it also prevents the patient from aspirating instruments. This can be more related while doing root canal treatment, especially when it's possible for patients to just aspirate or swallow small files or tiny instruments, burrs or anything like that. So with rubber dam, your patient is protected, and the patient won't be swallowing small items. It also helps in infection control. It acts as a barrier from distasteful products like etchants and astringents. It is also helpful in caries excavation because saliva, most of the times can, directly or indirectly cause pulp exposure during caries excavation. So rubber dam is going to take care of that too. Moving on to the disadvantages of rubber dam application. These are not direct disadvantages, but with the procedure. For example, it is not applicable for all the teeth. We have some teeth which are, supra-erupted or infra-erupted. Third molars, or if the patient has limited mouth opening, then rubber dam might not be the best option. Other than that, there are some points like if the patient has latex allergy, which is basically the material with which the rubber dam sheet is made, or if the patient is having difficulty to breathe uh, through their nose. So basically, the later two are just the patient related disadvantages or the factors. So moving on to the next topic, that is components of rubber dam. So the very first is the frame, which can be a metal frame like this or a fiber or plastic frame like this. Next up, we have a punch, which is basically used to make holes in the rubber dam sheet, and it looks something like this. After that, we have the forceps, or we can call retainer forceps, with which we are going to apply the retainers or clamps on the anchor tooth. So this is what a forceps looks like. And next up, we have a template, which is basically a standard guide of all the tooth. And it is just going to give you a better idea where you need to punch the hole for that specific tooth. And then we have different types of clamps or retainers, you can call them anything. And there are basically two types of retainers, wingless or winged. Winged retainers are basically the retainers which have this specific wing like extension, and wingless obviously lack them. So the rubber dam clamp or retainer is going to retract the gingival tissue. Obviously, it is also going to anchor the dam to the posterior most tooth or the anchor tooth. Then it is also going to prevent rocking or tilting. We also have the napkin, which is a basic, just a component, which is going to soak the saliva, and it is going to avoid saliva from dripping or seeping inside the mouth from the corner of the mouth. And we have water soluble lubricants, which are going to make it easier for the rubber dam sheet to pass through the teeth, especially in crowded teeth where they have tight contacts. Let us talk a little bit about the rubber dam material, which is the latex material of the sheet. So they can be of different colors and different thicknesses. I have these two examples. We need to understand about the different thicknesses and what is the purpose of having different thicknesses. So there are basically four different thicknesses of rubber dam sheets. The first is thin, which is 0.0006 inches thick, and this is going to be a little fragile. It might just snap easily, but it is going to pass through the contacts easily. So if it's a crowded arch, you can consider going for a thin rubber dam sheet. Second is medium, which I personally consider the overall best one. It has a good tear resistance, and it can retract enough amount of soft tissue. Next up, we also have heavy, which is 0.010 inches. It is going to give you more tissue retraction and obviously a little bit more resistant. And similarly, we have extra heavy, which is 0.0014 inches thick, and it is going to be more resistant to tearing. But the thicker it gets, the more difficult it is going to be to pass through the contact points. So you need to choose the thickness of rubber dam sheet based on the arch form. Like if it's crowded, you might want to go for thin or medium, and if there's spacing but you need good tissue retraction, maybe you need to go for heavy or extra heavy. So moving on to the next topic, which is rubber dam application procedure. Now, while we are at this, I just want to tell you one thing, that the correct way to read mind maps is to go clockwise. So in this particular page, we are going to start with the first procedure, which is on the top right corner, that is testing and lubricating the proximal contacts, and go through all the topics clockwise to the last, which is inserting the wedges. So the first step is testing and lubricating the proximal contacts. You have to use a waxed dental tape, which is just a secondary term for dental floss. Second, we have to punch holes on the rubber dam. You now know what a punch looks like. You can mark it with the help of a template or according to the arch, and you have to punch the holes. Next, we have lubricating the rubber dam, and this is a very important step because this is going to make your rubber dam pass through tight contacts easily, and it is important to do on both the sides of the rubber dam and also to prevent irritation. Next, we need to select the correct retainer and position it. So selecting the retainer, uh, you select either winged or wingless, or depending on the tooth number. You need to apply it on the anchor tooth, with the help of retainer forceps, obviously. We need to also test the retainer's stability. It should not rock on the anchor tooth. We need to position the dam over retainer. Okay. Once you have applied or put the retainer on the anchor tooth, then you're going to take your rubber dam sheet and put it on the uh, retainer or on that anchor tooth. Next, we have a napkin, which we have already understood. It is to be positioned on the patient's face to reduce skin contact. Next, frame placement and dam positioning. This is the important part. Here, the first thing you need to do is attach the frame. Okay, so we know what frame looks like. This, you need to attach the frame to the rubber dam sheet, And you see these metal projections right over here. This is where your rubber dam sheet is going to get attached. Okay, this is what is going to keep your rubber dam sheet in place. Next is attaching the neck strap, which is optional, and this is just an additional step in order to secure, and also an additional step in order to make your answer more lengthy. Next, we have passing the rubber dam through posterior contact. Ensure this is to ensure a seal around the anchor tooth. Applying rigid supporting material. This is another optional step in case if the retainer is not very stable on the tooth because it's not fully erupted or any such things, then you might want to consider adding a supporting rigid material. Next, we have to apply the anterior uh, anchor tooth, or just apply the retainer on the anterior tooth if you're doing multi-tooth isolation with rubber dam. Now, once this is done, you need to pass the septa through the contacts. Okay, so between two teeth, you need to stretch the rubber dam and pass it through two teeth, the contact point. You can do this again with the help of a floss. It is going to be very easy. Also, don't forget, we need to add the lubricating agent as well. We need to invert the rubber dam interproximally. So what inverting means is basically, once you punch a hole, there's going to be some part of the rubber dam which is going to fall on the tooth surface, which we want to go inside the sulcus, so that we have a better visual presentation of the tooth. So that is what inverting the rubber dam means. Then you do it facial-lingually. You can do it with the help of an explorer, or even with the help of any blunt instrument, any plastic instrument, for example, composite instruments or anything like that. Now, using a saliva ejector, which is basically a suction tip. This is again an optional step in case the patient has high salivation or something like that. You need to confirm proper application before you move ahead, obviously. Check for access and visibility, which is the primary purpose of rubber dam isolation. And then you're going to insert the wedges, which is the last step. So let us quickly revise all the steps in rubber dam application. So the first step is obviously identifying the correct tooth. You don't want to place the retainer on the wrong tooth. So you identify the tooth. You're going to apply the rubber dam napkin or the rubber dam sheet on the tooth. Then you're going to clamp the tooth. Okay. So I'm just going to show you quickly what clamping the retainer looks like. So I have my clamp placed on the forceps, and suppose this is the tooth marked in red is the tooth which we are going to clamp. So we're going to take this, place it on this tooth. I hope you can see this, like this, and just release it, and that is it. Your tooth is now clamped. Also, you need to check the stability of this. It should not rock or anything, and this looks perfectly fine. And that is how you apply rubber dam. So let us move on to the last point of this topic, which is removal of rubber dam. Again, going clockwise, the first thing you need to do is cutting the septa of the rubber dam, and this is supposed to be done with the help of a blunt tipped scissors, not a pointed one, obviously to avoid any injury to the gingiva. Next, you need to remove the retainer from the anchor tooth. Again, this is supposed to be done with the help of forceps. After that, you're going to remove the dam. Okay, release the dam from the anchor tooth and remove the dam as well as frame altogether. You need to wipe the lips, very important. Especially, it's mentioned because we've added a lubricating agent on the patient's lips, so it's important you wipe that off, and also saliva or the powder. Next, we need to ask the patient to rinse the mouth, and also massage the tissue over there to enhance blood circulation. We need to examine the dam. This is a very important step. You need to make sure that the entire dam is out, because when you punch holes, and especially while getting it out from the interproximal area, it's possible that some part or a little bit of rubber dam material is still stuck and the dam just tore. So you can check this if by checking your rubber dam once you get it out. So once you get the rubber dam out, just analyze. The rubber dam sheet should be having the only one hole, and it should be clean. There should not be any piece missing from the rubber dam. So for those of you who don't already know or are unaware with this, all of these mind maps and notes are present in a book by Medi Go, which is the Conservative Dentistry Mind Maps and Notes. This is what the book looks like. It's a absolutely fabulous book. So if you don't have it, go ahead, purchase it. You can get it from Amazon, Flipkart, or even directly from the Medi Go website. So once again, we are going to quickly revise with the help of a few questions. So this question is, what is the last step in rubber dam application for proximal caries cavity? So we have already studied that there are 10 steps in rubber dam application. You just need to note down or write down the last step, and the last step is wedge placement, as we already studied from those 10 steps. And the basic application for wedge placement is it provides a little bit of separation between two teeth, making it easier for proximal cavity preparation and filling, and also it provides stability to the matrix band. Next, we have one MCQ. So the question goes like, what is the disadvantage of winged rubber dam retainer? So we have already studied what winged and wingless rubber dam clamp or retainer looks like. This is what a winged retainer looks like, and this is a wingless retainer. The basic difference is presence of those wing-like extensions. So the disadvantage of winged rubber dam retainer is that it interferes with the placement of what? The options are matrix band, dental floss, rubber dam, and rubber dam sheet. Now, it definitely cannot be dental floss or rubber dam frame, because obviously the frame is outside the tooth, and not even rubber dam sheet, because that is going to go through the teeth no matter what, depending on the thickness and everything. So the only valid option here is the matrix band, and yeah, we're right, matrix band. And let's go through the explanation. The primary disadvantage of winged rubber dam retainers is that they interfere with matrix band placement. The wings, of a retainer, they are going to occupy additional space, which is going to interfere when you place the matrix band. It is either not going to go inside, or it is going to be not very effective, or it won't be the right shape which you want it to be. So another thing which I want to mention here is all of these questions with explanations, MCQs, and a lot more is present on the official app of Medi Go. So you can download it, and the Medi Go app along with this mind maps and notes book is definitely a dream team. So with that, we're going to complete today's topic. Thank you so much for watching the video. Also, this goes without saying, if you haven't already subscribed to the Medi Go YouTube channel, you need to do that. We regularly post similar educational videos, not just about conservative dentistry, but almost all the subjects. So please like the video, share it with your friends, and subscribe to the YouTube channel.